Hi, I'm Tom Eschen, and welcome to the award-winning Power in Politics podcast, the conversation about the issues that are impacting you the most with the people that are making the decisions, the advocates, the analysts, everyone in between, and holding them accountable along the way, too. Today, we speak to Patrick Wild, currently director of Albany Law School's Government Law Center, also formerly the former Assistant Secretary for Human Services and Mental Hygiene. He helped craft that $1 billion investment by the state into the mental health system in New York. So we talk a little bit about that as Governor Hochul has now proposed her budget for fiscal year 2027. We also ask him about involuntary commitment, homelessness, substance abuse, Daniel's Law, and much, much more. You can listen to this full podcast on our Power in Politics podcast page, or as always, watch on our YouTube page, CBS 6 Albany. We're joined today by Patrick Wild. He's the director of Albany Law School's Government Law Center. Patrick, thank you so much for taking the time for joining us today.
Absolutely. Thanks for having me, Tom.
Obviously, the budget is out from the governor's side of things, and now we get into the budget conversations, budget hearings. The one house has come out in March. The process has begun. From your standpoint, and the way you look at things, what did stick out? I know obviously it's very broad. There's a lot to it. But if you could just talk about one thing maybe in particular to start us off here.
Yeah, no problem. I mean, I think it's clear from a lot of the reporting and a lot of the folks that are talking about this that one of the big themes this year is affordability. And there's a lot of components to that. Certainly, there's a lot of noise being made about the movement towards universal child care statewide and the impact here upstate. A lot of stuff for kids, not just the child care, but some really exciting stuff to kind of protect young people online. And then the public safety and immigration pieces are important as well, looking to kind of regulate 3D printed guns and looking at some ways to kind of help protect New Yorkers from unnecessary inquiries from federal ICE agents and that type of thing.
It's always interesting. You hear about the conversations about policy, fund, where that should fit. Well, where do you think that should fit?
Yeah, you mean like the whole debate over whether there's room for policy in the budget or whether really should just be kind of like I think that the way we're set up here in New York, it gives the governor a lot of autonomy and a lot of authority and influence to push policy into the budget. It's the way it's been done for quite some time now. And, I think if you talk to certain folks in the legislature, they might disagree. But I think it sometimes is the biggest time of year where people are focused the most on some of these issues to get some really pressing policy initiatives that can help a lot of New Yorkers across the finish line.
What do you think they get out of the hearings?
I think that the chairs of the committees in particular, I think have good staff that support them, that help them ask really good questions, and they get the most time to ask the most questions for a reason. So I think that the governor has a really able, capable set of commissioners pretty much across the spectrum now for a bunch of different issues. So I do think that it does influence their one house bills that the legislature's put out, the legislative house has put out before the negotiations really get underway.
Obviously, you played a role in this in the past, former Assistant Secretary for Human Services, Mental Hygiene, the Office of Mental Health, other agencies like that. When it comes to list, obviously we hear advocates come in. You have lobbyists. You have those hearings. Where do you navigate that when it comes to setting these priorities and setting a dollar sign next to some of these initiatives?
Yeah, I would say that the more that folks band together and the more there's a larger set of voices behind a given initiative, typically the more movement there is on it. Certainly there are certain initiatives that based on the time of the year or based on recent events, there might be certain inclinations to move on certain topics. When I was there, things like maybe a subway related incident might prompt a real strong discussion about mental health and public safety. Obviously this kind of pervasive nature of social media apps impacting our young people, a lot of national research being done to support that might mean that those type of initiatives get a lot of attention. So I'd say that the advocacy groups have an important role in that, but there's also just an ear to the ground in terms of what the public is talking about and what New Yorkers want to see happen.
Yeah, you speak to mental health, the $1 billion that's been allocated for that, in the last few years. I think that's something that is bipartisan. I speak with people on both sides of the aisle, and no one rarely has a bad word to say about that. They know how important mental health is. Why has that become such an important aspect of this, do you think?
Yeah, I think that I attribute it a lot to the kids and to our youngest generation now who are coming up and more willing now to talk about mental health than any generation before them. And I think that is really permeating. I think the governor has been a real leader when it comes to youth mental health and taking different steps there to fund the system. But so many people, the incidences now that come out of national data, 1 in 5 people struggling with mental illness. Um, 50% of mental illness is presenting before people hit like maybe the age of 14 or 15. It's impacting every family, red states, blue states, of every demographic breakdown. So I think it's just becoming more commonplace, and slowly we're peeling back the stigma that has kept us from talking about it and doing something about it in the past.
Where do you think, obviously that's a lot of money, where do you think right now as we sit here in 2026 are the biggest gaps when it comes to helping that?
Yeah, I think on a statewide level, the biggest gaps when it comes to mental health funding is really on the workforce. There's a lot of really wonderful programs that the governor and the Office of Mental Health and local county level and local officials are pursuing. You need to keep the lights on in these buildings. A lot of the services for mental health statewide are run by community-based nonprofit organizations. They're not run by the state, they're funded by the state. And those folks don't get paid enough because the funding isn't there. And when people don't get paid enough, they're going to go work at Amazon or at Walmart or McDonald's before they work in direct care capacities. And they're harder jobs when you're working with people who are really ill sometimes.
Who's not paying them enough?
Yeah, so I mean I think the organizations themselves are nonprofits. So I think that they're trying to flow as many of their resources as they can into their workforce. I think that the state probably hasn't been stepping in historically enough to fund the mental health and really broadly the human services workforce as much as it could. I think under this governor, we've seen now with this budget announcement yesterday, I think that'll be the 5th year in a row where she's committed to doing a cost of living adjustment for this industry. But prior to her, the decade prior to that, there had been barely any increases. So you're looking at a workforce that has been underfunded for years. She's trying to catch up, but you can't do that in a year when it's been like that for 15 years.
Yeah, and that you spoke to this a little earlier, talking about when it comes to public safety, where these intersect, and we saw that last year with a little bit with involuntary commitment. Now that that's been a year, have you seen a result of that at all in your research? I guess what has been the impact?
Yeah, so last year's budget, just to remind folks, last year's budget called for an update to the state's mental hygiene laws as it pertains to being able to involuntarily transport and commit someone to an inpatient unit at a hospital for mental illness. Historically, the standard was that you had to be, imminent danger to yourself or others. And what last year's budget allowed for is now, law enforcement and clinicians can look for, someone not being able to take care of themselves, not being able to meet their own basic needs like housing and food and water to bring them into the hospital. Though that happened as part of last year's budget, which ended in May, the law actually didn't even take effect until August. It was kind of set back a couple of months. So I think we're still seeing how the impact is going to play out statewide. I do think that if it's going to yield more people being involuntarily admitted, it's going to mean that there's even more people in need of mental health services, and we need to continue to focus on that.
Obviously, that initiative did have was a bit polarizing, you could say. The civil liberties groups were staunchly against it. Where do you kind of see the line there?
Yeah, I think you need to be really careful when you talk about, to your point, like infringing potentially on someone's civil liberties. I think there are certainly very clearly people, and many of us probably see them when we commute to work wherever we live, who seem like they're not doing too great and probably aren't going to survive on their own on the street for very long. But I think when it comes to how we go about supporting those people, there's a lot of intensive voluntary outreach that can be done before we actually take someone against their will to a hospital. I think last year's budget bill, if not implemented the right way, could potentially do more harm than good to folks. But the State Office of Mental Health put out guidance a couple of months ago that's really supposed to fill in the gaps as far as how that law is supposed to be implemented and how law enforcement and clinicians are supposed to really approach it.
When it comes, I know you've held a recent panel on some of this, and you've written about homelessness and individuals that are experiencing that right now. And we've heard, maybe this could be combined in that. I think one of a couple of the responses were housing, right? That's one of the biggest issues here. How is that being addressed right now at the state level, at the housing aspect of things? And is it enough? I know we hear about this initiative, but is it actually working?
Yes, when you look back at that $1 billion investment that the governor made in mental health, and I was very fortunate to be on her team when she did that, a lot of the focus there was on housing. Now, that announcement came back in 2023. Housing doesn't open up overnight, so a lot of that came in the form of new capital, so actually building new, types of residential settings across the state that would actually house people. So I think some of those are starting to open up now. I think the stock is probably hopefully slowly starting to come online, but housing takes time. And in other cases, you have to renovate spaces that aren't suitable for housing to make it so that people can come in there who are living with mental illness and get the sufficient support that they need. So I think we're making progress. I know this year's budget, as of yesterday, calls for another 71 million to go into supportive housing programs, which I definitely think will help. Another thing to mention here, and you might be getting to this, is the federal government has its own kind of agenda when it comes to this space. And something that the Trump administration has been looking at is changing how they prioritize funding when it comes to things like the housing first model. So I think that yesterday's announcement might be partly in response to making sure that our supportive housing stock in New York stays the way it is and doesn't get kind of upended by federal actions.
Yeah, that's a good. I'm glad you mentioned that, because we've done interviews with these different organizations within the continuum of care throughout the state, and what that looks like, and how the language change is in which the people they can help in order to get funding is changing from the federal government. What is the state? I mean, you just mentioned it. Maybe that could be the answer, but where is this? Does the state fall in trying to make sure these organizations can do the work that they believe in, and say they have the data and the statistics to prove that housing first works?
Yeah, I mean, I think that putting more money into the budget to prepare for whatever might come our way from the federal government. I know the federal government right now is also negotiating their own budget specific to this kind of health and human services space. So remains to be seen where that lands. And of course, in the last week, we saw the federal government overnight say we're going to cut $1.9 billion in funding for different types of mental health and addiction programs across the country. And they reversed that in very short order because of bipartisan pushback. So, I think that there's maybe a little bit of caution now from the federal government about doing anything too drastic. But on the state level, the governor also in yesterday's announcement announced an increase in Medicaid spending. So many of the services that people who are unhoused or really seriously ill, that a lot of the folks who receive those services are on Medicaid. So it's really critically important that those folks continue to have coverage and have services, because the state ends up subsidizing a lot of the care that they receive.
Yeah, I believe the governor said yesterday it was $3 billion hole, she described it, in Medicaid from the federal government, right?
Yeah, I think it might have been that it was 10 million that they were looking to fill, but I think she might have been putting in 3 or 4 billion in, excuse me, to try to fill that hole for this year.
One more on the housing first question. It doesn't appear that this federal government really believes in that. And their responses to this have been, well, people are taking advantage of the system, as we see in other ways, or we're done trying to help subsidize people that don't need it. Or what do you make of that argument? Are people taking advantage enough where this is a big issue?
My sense is that's probably not the case. Look, when studies time and again will show that when someone has a roof over their head, it infinitely increases their ability to get well, whether it's that they're struggling with a substance use disorder or mental illness or both, and other societal issues, trying to find a job. If you don't have a safe place to hang your head overnight, then everything else kind of flows from there. So I do think that getting a roof over someone's head as a priority should still be something that we really seriously consider, even if they're still actively trying to manage mental illness or addiction.
Where do some of these other measures fall into place? Talk about building housing stock, building more affordable housing. We've seen an increase in housing access vouchers. We've seen the governor try and hold some of these, not the trust fund, these hedge funds more accountable. Where does that fall? What kind of weight does that have in this conversation?
I think it's all part of it. I mean, it goes back to the first question you asked me, right? I mean, the biggest agenda that she has right now is on affordability. And I think that the average New Yorker is having a hard time with rising costs. So when you kind of scale down to people who are living paycheck to paycheck and may be on the verge of homelessness, I think every bit helps. So I do think that all these things she's looking to do, I think she's also looking to maybe go after some home insurance companies and make sure that they're being held accountable, looking at making sure that utility companies aren't overcharging and that there's more scrutiny on both the executive leadership at them and how they're going about things through the Public Service Commission. So I think all these things lead back to the same general premise here, which is that housing is really important and we don't have enough of it in New York, and the governor is really trying to change that.
Let's get to substance abuse here really quickly, because I think that's another issue. But we have seen overdoses decrease. What do you attribute to that?
here in New York and nationally, we've seen decreases. I will note that it's not across every demographic group, but by and large, to your point, we have seen a reduction in that. That's really wonderful, and hopefully that continues to be that case for the opioid overdose crisis.
Before you go on, the demographic group part, can you go a little bit deeper into that?
Yeah, I think that when you look at the data, I think especially when it comes to African Americans and people of indigenous ancestry, I'm not sure if the rate of decrease in overdoses is quite as sharp as it might be for white New Yorkers and for other demographic groups. I think that the trends are all in the right direction, but I think it's always important to note that we can't paint with broad strokes with it, but progress is definitely being made in the right direction. Um, but I think what you attribute it to is kind of an all hands on deck approach. I think the state has been pushing out harm reduction supplies left and right. And I know sometimes that word has kind of almost a controversial connotation to it. But the reality is naloxone saves lives. And the state's put out millions of kits of naloxone through the Office of Addiction Services and Supports and the Department of Health. They're putting out xylazine and fentanyl test strip kits so people can test their medication if they are inclined to use before they take it. The state continues to put money into all the providers, the nonprofit organizations that actually take care of people who are experiencing addiction. So I think it's an all hands on deck approach to kind of turn the tide in the right direction.
You do hear those from the Trump administration tied to the border. Any impact there?
Yeah, I mean, it's obviously true that not all the drugs that exist in the United States originated here. So I do think that there's probably some correlation between trying to make sure that there's not narcotics coming across borders into the country. So I think that the data that we're looking at that shows the decrease in overdose statistics is really largely during the Biden years. So, I think that they also took some actions on immigration. It's been different than the Trump administration. So I can't sit here and tell you that it doesn't have a role, but I'm not sure if it's the prevailing factor in why the rates are down.
Because it goes back a little bit farther than just January of last year in terms of what the trends and when they began.
Correct.
Right?
And like a point of frustration for folks is we'd love to see the data come out more in real time, right? But the way that the data ends up lagging is we want to make sure we get this accurate through the CDC and through other national and state level agencies is that we're on a lag. So the data that we're seeing in terms of the decrease is really stuff that's dating back a number of months now. So to see what impact the Trump administration has actually had on the issue, it's going to probably take a little bit more time to see the data come through.
Where are we at when it comes to overdose prevention centers in New York?
Yeah, I'm glad you asked. As far as I'm aware, there are still 2 that are operational in New York City. One is in Harlem, one is in Washington Heights. They're both run by an organization called On Point. Mayor Adams had committed to opening 3 more. That didn't happen. Mayor Mamdani, I believe, had indicated an interest in expanding them, but I believe the last public comment I saw on him is that he at least wants to keep the 2 that are open still open. So there hasn't really been much movement on the state level. But certainly, as you mentioned, it's been a hot button topic, especially in the communities that they're in. And I think the federal government's probably still looking at how they're doing.
Should the state play a role in expanding? Should they say it's up to the community? Where should things fall there?
Yeah, I mean, right now, even on a national scale, there's not too many of these types of centers that exist. So the 2 that we have in New York are the 2 in New York City. So it's definitely worth a very close discussion with New York City government, which is a behemoth within itself as to whether it actually wants to continue to fund these and make it part of its kind of continuum of care for addiction services. So, I think it's always possible for the state to play a role, but I don't know, as it's currently constructed, that it's necessary. I think that funding-wise, they're doing okay without the state playing a direct role in it.
Do you have any thoughts on psilocybin?
Not a ton, but I think it's a space that needs to continue to be watched. And my overall ethos when it comes to mental health and addiction is that we need to be creative, we need to be inventive, we need to be cautious, certainly about trying brand new things that aren't tested. But anything that can potentially help people, I think we need to think through thoroughly. So I think it needs to be on the table when it comes to helping people out.
It's an interesting. It's been around for a few years, but I think we said there was a hearing. I think in December down in the city about it, and I wonder if it has legs in this session potentially. But there seems to be more of it, right? To talk about it right now.
Yeah, and I think that a lot of people are persuaded by studies, and seeing that more and more studies come out showing it's helping people. I think it's always worth something to consider. So not any more thoughts on that right now, I guess.
Okay, finally, Daniel's Law. And I think this is an interesting one because we've seen pieces of it, and we saw a task force with recommendations, all sorts of in that aspect. I am curious the law enforcement aspect of this. How do you convince, a police department, a sheriff's office, to be able, and because they will often come back and say, we already have training for this type of thing. How do you convince them to go along with some of these parameters that have been set?
Yeah. And just a kind of a brief status update as far as I'm aware of where the funding's at. Last year's budget called for $8 million to go into Daniel's Law, $6 million towards pilot programs, one in a rural area, one in a suburban area, one in an urban area in New York State, and then $2 million to go towards a technical assistance center that would help communities stand these up. I think that when you talk to a lot of law enforcement, and of course, I don't want to be, having a blanket approach to this, a lot of law enforcement don't necessarily go into the job because they want to be directly involved in behavioral health crisis response. But over the years, and as we've talked about, there's dueling kind of mental health and overdose crises. The reality is that law enforcement have been brought more and more into these situations where someone is in crisis from a behavioral health condition, and law enforcement's the first one to respond. So I think that in a lot of cases, law enforcement is welcome to having more resources at their disposal to handle the situation and hopefully simmer things down and make sure that someone has culturally appropriate care and can get into a care setting instead of the most dire result, which in some cases leads to death, right? When there's violent incidents involving law enforcement. So my general sense is that I think law enforcement is open to doing this, but I think it's the devil's in the details. And also funding wise, I've talked to a lot of rural counties and they don't have a massive mental health workforce there. So their law enforcement sometimes aren't even full time. So they're like, if someone's going to give us resources to change the way we do this, then let's talk about it. But if it comes without the actual resources we need, it's hard to kind of change how we respond to things.
Interesting. It goes back to what we began really about, was talking about the workforce and the individuals that are in this profession. And we saw that in Albany, the police department, and they wanted to roll out a couple of years ago, I think it was 20 social worker types in their department. And it took a while to hire for that. And now that's down to 10. So I think that goes back to the investment in a workforce to facilitate all this, right? And that's what that's what people like you are looking for as we move forward.
Absolutely. These are hard jobs and people need to be paid a really healthy wage to take on the care of people who are really ill sometimes.
Yeah. Patrick, really appreciate your time. Thank you.
My pleasure. Thanks for reporting on this.
Thanks for listening. Hit the subscribe button right now so you can stay up to date on these news-making conversations about the issues impacting New Yorkers the most: power and politics.